Hi guys, today I'll be demonstrating a procedure called Dermarolling in an acne scar patient. So for Dermarolling, I need a tiny instrument called a Dermaroller. So Dermaroller is essentially equipped with many tiny needles. So if you can closely observe, Dermaroller is equipped with many tiny needles. Dermaroller also comes in various sizes, that is the size of the needles. It comes, if you observe, it starts from 0.2 mm and it can go all the way up to 2.5 mm. So you choose the size of the needle depending upon the condition that you want to treat. So in case of superficial skin rejuvenations, you can choose a smaller size needle, probably about 0.5 mm or even 1 mm depth. And certain scalp conditions when you're treating, also you can go with a lesser depth Dermaroller. But when you're going for deeper skin conditions like acne scars or scars of any other form, you can choose Dermarollers of 2 to 2.5 mm. So for this patient, I have chosen a Dermaroller of size 2.5 mm. So as the first step, we have applied a numbing cream onto the area that has to be treated, and we have left it for about 40 minutes. So now we are going to remove the cream, clean the area and start the procedure. A new Dermaroller we've just opened. Dermarollers usually come in a very good sterile packing, but still for people who are really particular about creating a sterile environment while doing these procedures. So we have soaked the Dermaroller in an antiseptic solution for a couple of minutes and then rinsed it under cold running water. So after rolling the roller for a couple of times, if you see, the blood can get stuck to the roller. So I usually prefer cleaning it with normal saline so that the blood doesn't get clotted. And you know, after the procedure, if you want to clean it once for all, it becomes really difficult because the blood can get clotted onto the roller. So this will keep my roller really clean. So today is a lucky day for us because we are having a very cooperative client. So without sugarcoating, to be very transparent to the viewers, Dermarolling is a little painful procedure. In spite of applying the topical anesthetic, it can be a little painful. So immediately post procedure, if you can see, there is a little bit of erythema or the redness on the treated area. There is mild swelling. There is bleeding and oozing. All of this will subside and the skin will be back to normal in a couple of hours. So Dermarolling can also be combined with PRP injections. So PRP is platelet-rich plasma. We can also do without the injections, but I have found better results when I combine PRP with Dermarolling. So now let's move on to the other side. So how does Dermaroller work? What does it essentially do? Well, it produces tiny injuries or tiny wounds on the skin, multiple tiny wounds on the skin. So because of which several things happen. One, there is production of collagen and elastin fibers. There is increased production or stimulation of production of collagen and elastin fibers. Two, because of the tiny injuries or the wounds, the desired products can be sent to a much deeper depth. And three, it causes stimulation of wound healing, therefore improving the scars or the tiny blemishes that you see on the skin. So now, Dermarolling what are the indications of Dermaroller? Where all can you use a Dermaroller? So Dermarolling can be used as a skin rejuvenating procedure, wherein you don't have to go so deep. It can be a very superficial procedure. And you can stimulate the collagen and elastin fibers. It can be used to treat acne scars. It can also be used in treating fine lines, wrinkles, like an anti-aging procedure. So after doing Dermaroller, the skin becomes much taut, plumper, fuller and brighter. And if you're treating for the acne scars, the depth of the scars keeps reducing with each session. So the skin becomes much smoother and softer, reducing the scars. When you shouldn't be doing a derma roller, you should never do any sort of procedure for a patient who has unrealistic expectations. So counseling is the key whenever you sign a patient or a client for any sort of package or any sort of treatment. So never go close to the unrealistic patients. Do not do derma roller on an area which is infected. When there is a lot of bacterial infections, derma roller is a no-no. Just wait for the infection to subside. First treat the infection and then you can go to the scars or whatever skin condition that you're treating. So how do you typically do the derma rolling procedure? So the intention of doing derma roll procedure is to create multiple tiny injuries, as many tiny injuries as possible onto the area that we're going to treat. So how I'd like to do this? So first stretch the skin, give the stroke in all possible directions, up and down, side to side, then diagonal and diagonal. So this way you make sure that you cover the entire area and create many multiple injuries. So now let's move on to the forehead. So the thickness of the skin is different on the forehead compared to the cheeks. So if you want, you can go for a derma roller with lesser depth needles when you're treating the forehead. But for me, I keep the consumable cost for the patient in mind. So I'd like to go ahead with the same derma roller, but I wouldn't go as deep as I went on the cheeks. I'd go a little superficial on the forehead areas and the temple areas. Very superficial here, and I will also not be giving too many strokes on the forehead because she doesn't have a lot of acne scarring on the forehead. It's more of acne pigmentation that she has and also uneven skin tone, but there's not many scars, so I am not giving a lot of strokes on the forehead. And then we clean the treated area with a normal saline. Make sure that all the materials that you use in the procedure are all well sterilized so that there is no chance of any form of infection to happen post-procedure. So post-procedure, I'll be applying a serum onto the treated area. So this helps in cooling the skin a little bit, soothing the skin a little bit, and also helps in better wound healing. Covering the treated area with a mask, and we leave it on for about 5 to 10 minutes. Depending upon the depth we have gone, depending upon the erythema on the patient's face, depending upon the lifestyle, depending on so many factors, you can choose to apply a plain antibiotic ointment. You can also give a combination of steroid and antibiotic ointment to be applied at home for about 3 to 4 days post-procedure. Post-procedure, the treated area looks a little bit swollen, little erythematous. This should all come down in a couple of hours, and the patient or the client will experience a little bit of burning or stinging sensation in the treated area. Again, that also will come down in a couple of hours. And post-procedure of post-derma rolling, we advise the patients to wash their face with cold water. Do not use hot waters. And we advise them to use the creams that we suggest, so that the wound healing happens in a better way and there is no chance of infections to occur. So this is the first session. For the next session, depending upon the wound healing, I'd like to do derma roller or microneedling RF procedure in this patient. So after procedures like derma rolling or microneedling RF, a lot of patients and clients ask if they need to take any oral antibiotics. It's absolutely not necessary. Just a topical antibiotic and maintain the area sterile will